Human Service Committee is called to order at 12:09. Roll call, please.
Commissioners Nelson?
Here.
Kokendorfer?
Here.
Miller?
Here.
Jackson is absent with notice. Powell?
Here.
Markham?
Here.
Gingell?
Here.
Hoffman?
Here.
Commissioner Gershenson as ex officio.
Here.
Loops?
Here.
We have a quorum.
Thank you. Let's please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God. The first item is approval of the minutes from May 5th. Do I have a motion? Moved by Commissioner Nelson, seconded by Commissioner Markham. All in favor say aye.
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 Opposed? All right, the minutes are approved. The next item is approval of the agenda. I have a motion by Commissioner Gingell, support by Commissioner Nelson. All in favor say aye.
Aye.
Opposed? All right, the agenda is approved. Next item is communications. There are two items to receive under communications: the Retirement Compensation Board minutes and the VEBA board minutes from April. I need a motion to receive and file. Moved by Commissioner Miller, seconded by Commissioner Hoffman. All in favor say aye.
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 Opposed? All right, the communications are received and filed. We move on to our regular agenda items. The first item is a presentation from Oakland Community Health Network, Nicole Lawson, a person first response to COVID-19 precautions. Is Nicole with us?
Yes, hi. Good afternoon, everyone. Can you hear me okay?
Yes.
Hey. So good afternoon. I'm glad to be with you today and talk a little bit about how the Oakland Community Health Network has responded to the COVID-19 pandemic. If we can move into the next slide. I'm sure you're all aware, but we are the public mental health care system here in Oakland County, and our sole purpose is to support people in our community with mental illness, intellectual and developmental disabilities, serious emotional disturbance, as well as substance use disorders. And certainly since that's our purpose, it would make sense that leading with a people first is our primary value, and certainly how we approached our response to COVID-19. When COVID-19 became our reality, our primary goal was to ensure continued service provision and service delivery for the people that we serve. And so certainly then to achieve that, we started with very close collaboration with our provider network of over 150 providers and over 300 service sites just here in the county alone. And then we partnered with our community partners like the Oakland County Health Division and Honor Community Health to assess and to respond to community needs. We can go to the next slide, please. Certain aspects of this response was a bit tricky for us. Our expertise lies in the delivery and provision of behavioral health care services, and certainly the response to COVID-19 required a lot of medical and public health expertise. And so a lot of what we did up front was to be a resource and compile information like advice from the CDC, the state, our own local health division, And we worked really closely with the health division. Kathy Forsley and her team have just been stand up through this process. And they put on a special webinar for our residential providers who just had some unique needs and different things that we needed some help in terms of providing the best guidance for them. We also had the opportunity to meet with County Executive Coulter and key staff from the county who really continued to help us and to ensure that our provider network as well as OCHN as an entity had access to all of the resources that were being developed countywide. Our close work with the state, since our contract is with the state, allowed us to make funding changes that we needed to make in order to keep our network whole. So some examples of that are we were allowed to do retainer payments for some of our providers who had to temporarily close down because they delivered services in more congregate settings. And it also allowed us to pay hazard pay for any forward-facing staff who continued to serve people through the stay home and stay safe order. Next slide. So if there's a silver lining to having to respond to this, it would be our ability to deliver telehealth services. So prior to COVID-19, we were able to provide services using telehealth technology, but both the person receiving services and the person delivering services had to be in an office setting. And what the state did for us is they loosened a lot of those restrictions. So we're able to deliver case management supports, therapy supports in both individual and group formats for people who are in their home. And then certainly with a practitioner, they can be either in their own home or in an office setting. The one factor in all of that is that obviously you have to maintain the privacy of the person receiving services. So whoever's delivering those services has to verify that they are in some type of location or setting where they can maintain privacy of everyone involved. Our provider network was able to very quickly transition to providing most services through telehealth. There are some exceptions, and those with some of the services that had to be done face-to-face. If we can move to the next slide, please. So some of those services that had to continue face-to-face are listed on this slide. Certainly our crisis services that are provided at the Resource and Crisis Center. Recovery and supportive housing, medication-assisted treatment for people with opioid use disorders, specialized residential treatment, which more commonly referred to as group homes throughout the community. And then just some additional resources that we continue to provide face-to-face. People who are on medication that require injections would still go to some of our provider agencies to receive those. Psychiatric inpatient hospitals continued to operate during this time. I think I mentioned our access center. We also deployed a nurse to assist in delivering medication through the medication assisted treatment program at the Oakland County Jail. And we have a couple of staff who work in the jail just providing some therapy and care coordination type services that did remain in place and forward facing during this time. And next slide. And so I'm sure we're not unique in some of the challenges that we've had related to transitioning to a virtual workplace. We've shifted about 99% of our operations to being remote with the stay home, stay safe order. Again, the exceptions that I just kind of walked through, as well as we do have someone in our building from our facility staff to accept deliveries. We're having all of our meetings virtually, just like this one. It includes everything from our board meetings to meetings with our providers, staff meetings, and in our internal and our community meetings as well. But we know that this shift has taken a toll on people. Many people are struggling with isolation, and we're promoting the term physical distancing instead of social distancing to encourage people to maintain social connectedness, even though we have to stay physically distant. We've also started programs like our virtual pen pal program, where people we can support request a pen pal, and an OCHN staff person will reach out and connect with that person, write letters, send an email, just really reaching out to let people know that we're here, we care, and that they are not alone. The one downside to telehealth and remote work that we have found is that many of the people we support don't have the equipment they need to be able to fully participate in telehealth services. So trying to do a full therapy session or another type of session isn't always conducive when that person is on their phone or has a spotty internet connection, or when resources just aren't available for that person. So one of the things we've been doing is leveraging some grant funding from the state to obtain tablets, so that the people we support can at least have access to something that has enough of a screen, and enough memory to hold the HIPAA compliant telehealth monitoring services. One barrier we know exists but have not been able to plug, is a long-term sustainable solution for people who don't have access to reliable Wi-Fi. So I'm sure as we continue to move forward into what our new normal is going to look like, finding and being able to find reliable Wi-Fi for people so that their services don't experience any kind of gap or lapse is going to be very important for us to move forward. And next slide. Thank you. So part of our ongoing communication has been that we want to be a resource for our providers and certainly the people we serve. And we've built a COVID-19 section onto our website, like I know the Health Division has done and many other organizations have done. And this holds all of the compiled guidance that from the national, state, local experts. And then it also contains a Q&A for how this information applies directly for our provider network and the service delivery system that we support. We've also started a Hope Starts Here campaign just to make sure that people know we're here and know that they can access our services. So that includes the number to our access line should someone require a behavioral health screening or linking to other community-based resources and supports. And next slide. So I mentioned earlier that our first priority is certainly to ensure that we continue to deliver services. And a big part of that was access to PPE or personal protective equipment and important supplies. So with so many providers in our network and many of them being very small, we made a decision early on to go out and try to procure needed supplies that included PPE for our provider network. We've been able to get things like general surgical masks, the N95 masks, gowns, hospital grade disinfectant, gloves, face shields, hand sanitizer, and other supplies that our providers have been in desperate need of during these times. We then have what we refer to as our volunteer brigade, who go out and deliver those supplies all around the county. So we've been able to deliver on a fairly regular basis every several weeks some basic supplies like hand sanitizer, gloves, and disinfectant. The other supplies that have been in very short supply, like the gowns and the N95 masks, we've been able to coordinate with the Health Division. And so when someone has a positive diagnosis in one of our settings, the Health Division has been able to supply the PPE needed for staff to continue to supply those services. And so we've kind of then taken the stance of if we have someone with known exposure or is presumed positive awaiting test results, then we're supplying the PPE in those instances. We are unable, unfortunately, to just supply it as a protective measure across the board simply because there just isn't enough of a supply right now for us to be able to do that. And you can see on the slide that we do have our next planned delivery of larger supplies like the disinfectant and the gloves planned for June 5th. And next slide. So as we're moving through the response to COVID-19 and we're seeing the curve flatten, thankfully, in our area, we have begun plans to reopen our building. We're going to be starting in June, and with those staff whose roles require them to be in an office, as well as our executive leadership team will all be returning to the office once the stay home, stay safe order has been lifted. We're going to allow the rest of our staff to continue to work in either a hybrid fashion, where they're in the office part-time and working from home part-time, or working virtually through the month of September at this point. We've shifted our on-site events to virtual, and we've done that through the entire summer just so that we have the flexibility as the governor issues different executive orders and we have different guidance around how many people can gather at any one time. Knowing that we've shifted everything that far out just allows everyone to plan appropriately so that we can be responsive to people's needs. And certainly as the governor begins to reopen, we're going to continue ongoing services for the people we support and putting the health and safety and well-being of not only people served, but our provider staff and our community as a whole first. And so with that, that is the last slide I had. If anybody had any questions, I'd be happy to do my best to answer them.
Any questions?
Penny,
Yes.
Marcia, not on yet, but here I am. I do have a question. You mentioned that a lot of your constituents don't have tablets. I'm wondering, what did we do with our old tablets? And are you looking for donated computer equipment?
You know, I don't know that we've thought about donations. We do have access to grant funds, so we're purchasing some newer ones. But if you had some that you weren't utilizing, I'm sure our IT department would be interested in having a conversation just to make sure that they could support the HIPAA software that would need to be downloaded on them. And certainly we would not turn that type of a resource away. Thank you.
As far as your tablets, we had you keep your tablets for the time being to follow the packet while you're video casting.
I mean the old ones.
Yeah, your iPads. We had the commissioners keep them for the time being.
Okay.
Yeah, and if we went down that path, if I may, Madam Chair, we probably should also check into the proper procedures because the tablets were paid for with taxpayers' money from the general fund. I don't know if we can, I don't know the process to provide them to some other nonprofit.
Thank you. Any other questions? All right, thank you, Dr. Lawson. And I've been remiss, I need a motion and support for the presentation. Moved by Commissioner Miller, supported by Commissioner Kokendorfer. All in favor say aye. Opposed? All right, so we'll receive and file this report, and then we need to step back up and move to public comment. Is there anyone from the public online or on the phone?
Currently, there's no one on the line. They haven't been since the beginning of the meeting, and there are currently no email submissions.
Thank you.
You're welcome.
The public comment is closed then. So then we'll move to our second item on the regular agenda. I need a motion for discussion on the resolution appropriate CARES Act funding for an Oakland County COVID-19 Veteran Relief Fund. Moved by Commissioner Hoffman, seconded by Commissioner Miller. So I want to thank everyone. Again, this is a new and novel idea to provide veteran support that would qualify under the CARES Act for reopening kits for American Legions and VFWs across Oakland County, or whenever they can reopen. Testing with our mobile unit at the American Legion and VFW posts starting after Memorial Day. Veterans PPE kits, grant programs to veterans who need support with mortgage, rent, utilities, and technology assistance so that they can access telemedicine with their doctors. Some of our veterans really rely on the veterans hospitals. So monies will be used to support veterans, service members, and eligible family members with emergent health, economic, and financial assistance. Our Veterans Department will be running this initiative. Are there any questions? Commissioner Gingell?
Thank you, Madam Chair. So I'm reading it says that the $743,521 will be CARES Act money. but then it talks about will be appropriated in the general fund public services department. So are we using existing money that's going to be replaced or replenished by the CARES Act money? Or are we literally taking some of the $219 million and appropriating it in a general fund line item so that it can be used for this purpose?
Well, the County Veteran Service Fund grant, the $256,000 that was redirected from the total $363,000 award will support the emergency COVID support for veterans. We are allocating the $744,000 to make it 1 million. But that piece does seem to be reimbursable. Is there anybody else in this meeting who would be able to speak to that?